Okay. And now let's say you were ready to go prone. So you see far left button there. You're going to press that. And you're going to get this rotate and lower button. And you can see underneath it in really little letters it says press and hold. So press and hold that rotate and lower button until the screen changes. Okay, so now you have a longer checklist to be calling out to someone at the head of the bed. So as you move through these, just touch the yellow arrow and they will turn into a check mark.
Check tubing, check.
And lastly, you're going to confirm that the face mask is in place. The face mask should just be barely, lightly touching the patient's face. It does not need to be clamped down hard. In fact, it shouldn't be in order to reduce your risk of skin injury. So once you confirm that that's in place, hit confirm. And then you'll see there the prone button. Again, underneath it says press and hold. So you're going to press and hold that until the patient is proned. And should something start to pull or a line gets too taut, you can lift your finger off of that button and it will immediately stop. Okay. And now it's going to give you another short checklist because we do always want to have them rotating while they're prone. So you'll run through this again. Just touch the yellow arrow. It'll turn into a check mark. And then hit start rotation. Okay, and so for CPR you have three options. One is on the screen here, you can see in the bottom right hand corner. Another is on the footboard of the RotoProne, and yet there's another manual operation on the side of the RotoProne, which we'll get to here in a minute. But for right now, let's just say conventional CPR. We're going to press and hold the button on the screen. And you can see that they're going into a supine position, but there were not any checklists to check off. So you want to make sure someone's still at the head of the RotoProne to make sure no lines are pulling. But that's what makes this so fast, is there's no checklist and it's doing all of the supination for you. Okay, now your patient's over in supine, so at this point, once they get a little bit more centered, you can go ahead and push in the lock pin on the footboard of the RotoProne, and that'll secure your patient from rotating any further. Here you have your second CPR option, so this is going to be a press and hold again. It will bypass all the checklists, just as the one on the screen. It's just sort of a backup to the original button. So in case, as a backup to the backup, you can use the manual CPR lever. It's on the footboard here, that red handle. It's always zip tied with a bright yellow zip tie. Just break that off. By pulling on the red lever, you're going to go from engage to release. So south, yeah, go ahead and do it. Now that's going to unlock the RotoProne. As you can see, it's sort of jolted there. What we want to do is make sure we go supine the way that we went prone. So if that makes sense. The whole RotoProne is not doing a 360-degree return. You should return the way that you came. So that's what we're going to do here. Go ahead and manually turn. Now, one word of caution when it comes to the manual CPR, it will bypass all of the safety features of the RotoProne. So in theory, if those back hatches were open, you could supine your patient, which is obviously an unsafe situation. So at this point, you can go ahead and re-engage that red lever, and it will now lock the RotoProne back in place. Okay, so if you need to, for some reason, manually prone your patient, there is an option to do that now. First, what we're going to want to do is make sure that our patient is flat and at 0 degrees. If they're not, there are instructions on this yellow sticker here at the foot of the RotoProne to instruct you on how to do that. So first thing you're going to want to do is engage the emergency CPR release handle. Next, you're going to find the red switch underneath this little door here that's between the CPR button and the lock pin. So you're going to press and hold that up towards the ceiling, and go ahead and do that. And once you hear that beeping and see that glowing red light, you will be able to manually prone your patient. Keep in mind you still want to be going toward the ventilator. And now that they're prone, you can release that and move over to re-engage the manual CPR lever. So our patient has been moved over from their hospital bed to the RotoProne. At this point, you've put in the leg abductor already. That footboard there is coming up to the balls of her feet, not hyperextending, just comfortably so. When we're looking at the position of our patient in the RotoProne, we want to make sure that we're focused on the face and the head. And in the the head cradle, we want to be sure that we're able to visualize her ears through the holes in the padding on each side. Likewise with the head cradle, there's a black star key but up there at the top. You're going to use that to bring that in and away from the patient's face. What you want when you're looking for positioning here is just for it to be lightly touching your patient's cheeks. So imagine you want to be able to slip a dollar bill in there, just barely touching. When it comes to the two side rails, there is a black crank on the opposite side of the RotoProne that you're seeing now. Go ahead and crank that in. That will bring the two side rails closer to the patient's body. What we're looking for here is that along the torso and the hip area or pelvic area, that it is difficult to reach the mattress when I'm reaching in between the side rails and the patient's body. The reason we want them very snug in these side rails is to prevent friction and shear injuries when they are rotating. Okay. Arms are fitted into the arm slings on either side of the side rails. And now we can start with the supplement pads that are provided in the black bag with the RotoProne. So we generally will start from the feet and work our way up to the head. So first is going to be the two shin pads that rest on top of the shin. Each pad is labeled with where they are suggested to go. When you do place them, just make sure that the labels go up and are not touching the skin. Next is going to be your abdominal binder. That is the black Velcro piece. It's going to feed in through 3 gray tabs on each one of the side rails, just right next to the arm slings. When you are working with this Velcro, you want to, with the top straps, sort of angle down as you come and reattach it. With the bottom straps, you're going to want to angle up when you reattach it, simply because our patient is without a gown and we don't want that scratchy Velcro touching their skin. Okay, next is going to be the pelvic pads. Those two will be rested right on top of the pelvic bones. This is going to depend greatly on how your patient is shaped and sized. They can just rest right on top of the abdominal sling. And then next is going to be the chest pad. When you place this, you want to line it up to the clavicle. And that just rests on top. So now, just like the supplement pads, we're going to bring up the prone packs themselves on the RotoProne from the foot and working our way up to the head. Each prone pack set has sort of a set of rules, if you will. With the first prone pack, we're starting at the lower leg. You want to adjust that to where it's never over the toes. So these prone packs, as you can see, they can slide up and down along the casters that they're on, but we want to adjust it, make sure it's never over the toes. You're going to cinch that down nice and tight, make sure it does not move away from the RotoProne. Next one up, you want to try your best to avoid their knees. Okay, after that is the abdominal prone pack. This, if they have a larger pannus or if they're pregnant or just have a large belly, you're going to want to avoid putting pressure over the abdomen. So it may be that you need to go a little bit low on this one. Next is the chest prone pack. This one's really simple. Just bring it all the way up to the top of the RotoProne. So just go as far north as you can with this one. And now with the chest pack, it's important to know that you're going to buckle it, but don't tighten it down quite yet. With what we're going to do here is we're going to open that hoop gate at the head of the bed. So there's it's actually the silver button. There you go. And now we're going to place the face mask. If you see this face mask, the most important thing to note is that you want proper placement. So you want to always be able to visualize their eyes and their mouth. When putting the face pack in place, you really just need a few clicks to each side. You should not be too tight on the patient's face. It really should just be lightly touching, and you can adjust that for any sort of face type that you have. All of their tubes and lines will be going through the tube management system at the head of the RotoProne as well. So at this point, our patient is ready to be proned.
Tubing good?
Tubing's good.
Airway's good?
Airway's good.
Head support?
On. Secure.
Arm slings are on. And abdomen support is on. Face pack is in place.
Check.
Are you ready?
I'm ready.
Rotate. Okay, start with the rotation.
We're good.